Last night, we took a look at childhood cancer and the delay in new treatments for kids who are in that fight.
Tonight, a deeper dive into the work being done to make treatments designed for their growing bodies and how that work relies solely on private funding to succeed. It's a harsh reality for many parents, hearing the words, "Your child has cancer." And while childhood cancer is considered rare, the treatments made specifically for their little bodies are even more so.
Most people think about cancer research as cancer research, and that adult cancers, probably those drugs are just applied to children. And it doesn't work that way for many reasons.
Kay Kohler is the president and CEO of CureSearch, a national organization with a mission to end childhood cancer.
And we want those new therapies to be less toxic than the current standard of treatment.
Childhood cancer is different from the adult diagnosis because children's bodies are still growing.
When we found out that our daughter was being diagnosed with cancer, one of the questions that I had right away from my very layperson's understanding of chemotherapy is designed to kill growing cells.
Erin Edlin's daughter Lolo is just over 500 days into her treatment for acute lymphoblastic leukemia.
You put chemotherapy treatment into a body that's 4 years old and growing, that's a pretty terrifying prospect.
Which is where the dedicated work from CureSearch comes in. CureSearch works to bring new treatments into clinical trials, from lab development to treatment deployment.
If your 6-month-old is diagnosed with cancer, they can't take a pill. How are you going to give them a therapy, right? So it's everything from the logistics to the treatments themselves.
I think one of the challenges is that the treatments that we're using are still old and they have a lot of side effects.
Dr. Jill Beck is one of the leading oncologists at Omaha's Children's Hospital.
We are behind in terms of pediatric cancer. The average is about 6 years after a medication or a treatment is introduced in adults that it is then introduced in kids.
She and Dr. Melissa Aquasino work with the families facing this terrifying diagnosis every day and see how the lack of federal funding that childhood cancer gets impacts their patients' health.
In pediatric cancer research, we receive a very small percentage of the money that's out there that goes towards cancer research. The majority goes to the adult world.
Because of this, many treatments these kids face are outdated, which is why Children's Hospital works with clinical trials to find treatments that are less harmful on these growing bodies.
We work with the children's hospitals around the country to standardize how we treat kids with certain diagnoses.
What we're really working to do is kind of all sides of it, trying to figure out why kids get cancer and decreasing that, and then also working on the other side to get better, more effective treatments that have fewer side effects.
But with so little funding behind childhood cancer research, organizations like CureSearch rely on donations to get better treatment options off the ground.
It costs about $800 million, I've been told, to bring a drug to market. So we are solely dependent on donors, right, who are interested in making an impact with their investment in childhood cancer.
And that investment can have a profound impact for decades to come.
We need to not just cure children, and I use the word cure in quotes. We need to ensure that they don't have to look over their shoulders for the rest of their life wondering if they're going to have congestive heart failure at 23 years old.
For more information on CureSearch, their mission, and how you can help, or to see part 1 of this series, visit our website, SiouxlandNews.com.